Thank you for that introduction, and to the Science and Tech Forum for this opportunity. Well, it's quite something to follow Mike Burton's presentation, but it reminds me when I was presenting at the university about the Northwest University's new medical school, and I shared the platform with Prof Geerwes, who's also a very recognized person in this field of science. So my presentation is, I'm pleased that I can follow on, because I thought some of my ideas also fall in line and are synergistic with not only his presentation, but with the previous presenters. It's as I said, it's a real honor and opportunity to be part of this forum, to look at how basic sciences fit into our educational system. And I entitled my presentation, Regenerating Basic Sciences for Healthcare. And it's just, this is a brief outline of my presentation. I'll obviously give it some frame in the introduction. I'll do a bit of a rapid appraisal on the status quo, what and how we use basic sciences at the moment. I'll make some reference to the pandemic and the need for basic sciences. I'll endorse it, and the opportunities and the necessary paradigm shift, which has been alluded to by previous speakers. So, as introduction, people have got my bio. I'm a public health physician, and not many people know exactly what a public health physician is, so I'll just explain it briefly. It's when you train to be a doctor, you're trained to focus on the patient, and often when one specializes, one's trained to focus on an organ within the patient, and then sometimes to even a subsection of the organ within a patient. As I say, you get more and more specialized until you know more and more about less and less, until you know everything about nothing, which is, nothing's also important in the grand scheme of things. But public health physician is a person who looks away from the looks up from the patient or the client to see what's the environment, what's causing the health conditions. And it obviously covers a lot of things like communicable diseases, health services, etc. And within it, recognize the complexity of natural life. It's I'm not sure if previous speakers mentioned it, but wicked problems and wicked and how they are solved is a different process to what's previously. And the healthcare service provision is the most complex human activity on the planet. Science has done amazing stuff getting a robotic activity going on Mars. Think of that. So that's difficult, but the complex is different, is a different component, and it's to do with nature. And with it, there's the need for reverence for life. As a doctor, and I've had a number of years of clinical practice in urban and rural environments, and you recognize that death is also part of life, and it's often forgotten in pandemic responses that. Albert Schweitzer was the person who drew me to this phrase, reverence for life. And I had the fortunate opportunity when I was doing some research on one of the pharmaceutical products for the big pharma I was working for at the time, an anti-malarial combination drug. I went to his hospital in Namreni in Gabon. So reverence for life is important, and previous speakers have alluded to this, the importance of that. And just as an aside, in terms of value, now people spend money on what they value. People thought that the biggest global industry was the United States military budget of $700 billion. But it's in fact is the healthcare industry, which is 4 times that. And it's fueled largely by the pandemic, not of HIV and all these things play a big role, but are largely neglected, non-communicable diseases. That's where the bulk of the spend goes. So it's the biggest industry on the planet. And this is some of the some of the perspectives I'll try and carry through in my presentation. Now, just a quick rapid appraisal of where are we. You know, South African sciences on a global scale. Well, Mike Britton went through all the African accolades of intellectual capital that we've donated to and gifted to the global knowledge base. There's a couple of others I'd like to add. Did you mention Max Tyler? I'm sure you mentioned it, but our community oriented primary care approach to healthcare by Sydney and Emily Clark in Pulele district in KZN. That healthcare philosophy has gone worldwide from those humble beginnings in Pulele. So we've got the talent, we know it, and we've got the talent that we can unlock very quickly if given the opportunity to do so. Now, South Africa's schooling capability range, we go from the very well-resourced private schools, of which me with my white privilege, I benefited from it. And learned a lot that other children my age never had that opportunity. And I'm thinking currently with the pandemic, where schools were closed down. I live in rural Ditsabotle in the Northwest Province, and I'm aware of how those schools being closed in the deep rural areas affected children. And that's something that we need to, and hopefully my presentation can look at it. So we've got this amazing Gini coefficient, which the pandemic worsened in terms of educational capacity and responsibility that we've got. And in terms of the talent development, well, that will be, it's such a shame that that talent, with those 2 years of no contact with any educational inputs for 2 years, what that effect has on a young mind. And I think we'll feel this for a number of years to come. It was one of the, as a doctor, one of the previous speakers mentioned about the Hippocratic oath, and part of it is primum non nocere, first do no harm. And the epidemic response did a lot more harm than the epidemic itself. So that's another aspect that we need to learn about, and I'll touch on these things, these issues a little bit later. Now, what is this knowledge lag time? I think the pandemic response reflected that it had little perception of a concept of the virome. I'm not sure if the audience understands what the virome is, and the microbiome. And these are really important concepts which relate to human and planetary health, and the necessity for biodiversity for general health. There's a lag in the application of knowledge by often many decades, and it's been known that concepts such as the microbiome and the virome has really changed the perception of how human beings perceive themselves within the planetary environment. And the adoption of this new knowledge is still not being reflected by a lot of the scientific effort at the moment because of this lag time. And we have an opportunity now, because of the pandemic and the way we're communicating, to accelerate this delay. And it has indeed happened with the pandemic. Information these days, if you publish in the Lancet this week, next week it's almost like a newspaper. Next week's Lancet has got the latest, so it's almost by the week that people are being cited with new information. So it's changed the acceleration of knowledge transmission tremendously. Is there a need for basic sciences and its knowledge and application? Previous speakers have outlined it, and given that an amazing amount of thought over many years, and to the provision of science centers, which I think are an amazing and really great leap forward. I'll mention the reason why in a minute. Yes, obviously healthcare provision is fundamental. All those sciences are necessary for it. I don't need to, there are various levels of it. And then it comes down to personal health and maintenance of being well. And then one can think of it on what they call the upstream determinants of health. What foods are we eating? What's the quality of the foods that we're eating? What's the global food industry feeding us at the moment? How is it linked? How close are we to our source of food? How separate are we from our source of food? These are aspects I'll mention in terms of where it's all part of the status quo. We all know our water systems. I think we've heard recently, don't swim anywhere near Durban, or else you won't be able to play rugby. I think that's one aspect of water. In terms of public health, waterborne and water-related diseases is fundamental to many diseases. Air quality. We're ignoring air quality and the role it plays in our healthcare. And the 2.5 particulate matter per square meter, how many of those tiny particles of pollution per square meter? And there's almost a linear correlation of that density with ill health and disease. And I've never seen Gauteng as polluted as I saw it these last few winters, even with lockdown. And people wonder why and how all the major cities with their inversion layers in winter, where our viruses are also active for various reasons, they clump onto these small particles. And so instead of inhaling one, you you'll inhale a particle which got a whole clump of viruses on. So it affects the dose you get. And then the soil, what are we doing to the soil? How is that linked to the nutrition? So do we need these basic sciences? Obviously a big yes, but you see at the bottom, it's the yes, but. How do we need these basic sciences? So at the moment, we're mainly using these basic sciences on how to use and exploit the planet. I'm talking simplistically, but within this, it's largely an extractive process, and that's fairly obvious with mining, and the consequences of mining and the paucity of emphasis on recycling products that are mined in all forms, and that can include plastics. Agriculture is, and the agrochemical industry is very extractive. It's and very also destructive in terms of its reduction in biodiversity. We know how extractive the fishing is, even to strip mine the ocean floor to remove everything and haul that up to the point of extinctions. Employment into these industries of agriculture, mining, fishing is extractive. I've just been part of the ex-miners process in the Northwest Province, where they're compensating miners for the occupational illness that they've accrued whilst mining the wealth from the depth of our mines. And their compensation for their lungs to be destroyed was, I think it's 160,000 rand. That's what your lungs are worth, if you'd like to work on what an extractive process is. Energy, extractive, and obviously the economies that underlie it are reliant. If you keep on extracting, it's dependent on endless growth. That's why more and more mines, more and more forests are burned down for agriculture. And it also requires a concept of scarcity. And I'll deal with why it has become extractive and why this concept of scarcity also drives the process. So we've all know that there's been a very significant global event in the form of the pandemic, but more often, importantly, the response to the pandemic. And within healthcare, when I've managed epidemics and outbreaks, I've done many, from cholera to hemorrhagic fevers to malaria to nits and lice to the last, it is so important not to instill fear in a response. And sadly, that fear response was used very indiscriminately throughout the pandemic. But the importance of it is the fact that there's a global acceptance of poor health status. Not only now, in terms of never wasting a disaster, let me just put it in a very personal way, which is also important. When I was managing health services within the Northwest Province, we used to have maternal mortality meetings when we discussed the death of a mother during childbirth. And you can imagine for a family what a catastrophe that is. And with that, I always tried to assist the services to learn from if there was a mistake. And often there aren't mistakes, but if there was a mistake, how and what could we make sure it doesn't happen again, and let that life not be lost in vain. So the acceptance, never waste a disaster. This pandemic was a tremendous disaster. I've just alluded to slightly within the health sector, education, within the education sector, within the health sector. Childhood immunizations have gone down. There's a lot of childhood indicators which have also deteriorated, et cetera, et cetera. A lot of other health promotion issues have been ignored with the focus on the response that was framed. Now, in getting better of any illness, it's important to accept one's diagnosis. It makes a big difference if one accepts one's diagnosis. And I think there's been a global acceptance that the human population is not healthy and the planet isn't healthy. And what that's in terms of the poor health status, non-communicable diseases. I was at the AfriHealth Forum in Lagos in 2019. AfriHealth is the collection of health professional educationalists. It was announced that non-communicable diseases have eclipsed communicable diseases in Africa. Can you believe it? It's incredible. Because in the 1960s, when in Uganda, when Richard, I've slipped his surname, a physician who ran the health services, he's a surgeon, in Uganda, never saw any non-communicable diseases, no bowel cancer, no breast cancer, no arthritis, etc. And that was based on the African way of life, in particular, the diet. Human beings' activity on the planet, for the first time in archaeological and paleontological history, has a single species played such a role in planetary changes such as climate changes and extinctions. So,
Prof Robinson, sorry to interrupt you. Can you wrap up in 3 minutes time?
Yes. Oh,
please.
Okay. Now that gives us the option: do we set if our computer breaks, we want it to reset as it was, exactly as it was before. And do we want an approach to the planetary health as it was before, which didn't recognize that the Gaia principle, that science was separated and had to be in odds with it, with its antibiotics, with its pesticides, which have caused a lot of the current illnesses. And most of this, which other speakers have mentioned, indigenous knowledge systems have shown us that they were correct. And we need to reduce the reliance on technology and technological solutions, because it cannot replace life. And the opportunity that it offers within our educational systems is that those disadvantaged schools, with the leapfrog technology that has been mentioned, are often living in areas that are close to nature, that can recognize this and make this link, and with relatively few resources can possibly leapfrog those northern countries that haven't got that, who are so far isolated from it, and lead the response for the recognition of the application of basic health sciences towards planetary and contributing towards planetary health, and not as it currently is, to extracting and exploiting it. So it was really challenging to put this into, I don't know how many minutes you've squeezed me into, a really complex topic, but just to thank this forum for reaching out and encouraging this sort of interaction, which is a natural way we should be working together. And I think the problems of the planet in terms of the way that technology has been applied can be reversed, because it's been made by human beings. The people working in corporations, and I've worked in a pharmaceutical multinational corporation, are all good people. People in the agrochemical industry are also farmers, great people. And if we just refocus that we are part of life and not separate from it, and if we can adapt our natural science teaching to naturally behaving sciences, I think we've got some opportunities in this country to possibly patch up the post-pandemic problems and really decolonize the educational framework and reestablish the African intellectual capital as in its place. Thank you.